evening. How are you today? Excellent. Okay, we'll start by getting your first and your last name. Okay, and your last name. Okay, Smith. Okay. Okay. And when was the last time you visited us? Okay. Last September. Okay. That's great. Yes. Mr. Mr. Webster will be in later today. Are we the only sleep clinic that you visited recently? Okay. And would you say your sleep patterns have gotten worse, or do you think that they've gotten a little better? Yes, right. Well, on a scale from 1 to 10, do you think 10 being that it got worse, or 1 being that it's gotten fairly better? Okay. So about a 6. Okay. Yes, ma'am. That's correct. We want you to continue to take the Ambien until Mr. Webster says that it is okay for you to come off of the Ambien, okay? Okay. Okay. Now I want to discuss the side effects of the medicine in case we want to decrease the dose, okay? We've noticed that most patients that take the Ambien have the groggy effects the next day. And what we want to do is try to bring this down because we want to be able to help the patient. But sometimes the patient doesn't want to take the medicine because of the side effects the next day. So if you can, give us some examples of how you feel maybe the next day when you wake up. Okay? Yes, so you do feel groggy. Okay. Okay. Oh, and lightheaded sometimes. Okay. Yes, ma'am. All right. Yes. Okay. So do you find that when you wake up in the morning that you have enough time for your body to sort of heal before you start to drive? Or is it not enough? Okay, not enough time. Okay. Okay. And right now you have the 10 milligrams, is that correct? Okay. Yes, and the 1 pill at bedtime. Okay. Have you reported any depression? Do you feel different emotionally while you're taking the Ambien? Okay, so you don't feel sad? Okay. Okay, so no, you don't feel sad. Okay. Okay, so you hallucinate. Can you describe some of what it is that you see? Okay. The walls appear to move. Okay. Yes. Well, as much as we really don't like this, but hallucinating is actually a common side effect of Ambien. There's really no way to get past that side effect. We're working on that though, okay? And what other side effect? Dry mouth, okay. All right. How long would you say after you actually take the pill that it actually starts to work for you? Okay. So about 45 minutes. Okay. And do you feel that when you take the pill that it works and you stay asleep all night? Or do you still find yourself waking up? Okay. So you sleep fairly all the way through the night. That is excellent. Okay. And do you take any other medications at this time? No. Okay. As long as it's not Tylenol PM, if you want to take something to manage pain, you can do that too, okay? We just don't want you to take anything with codeine or anything that's going to assist you in sleeping, such as NyQuil and Tylenol PM and Excedrin PM. You just want to stick to the Ambien to help you get some rest. Okay. Another thing that we usually advise the patients is to see if maybe before you lay down that you can just turn off the light and lay in the dark. Sometimes laying in the dark can help. Sometimes just having a glass of warm milk can help. Okay, so sometimes you do have milk. Okay, so you can also have the lights off to help you. We try to let patients know to limit their activity before they lay down as well. Because if you slow down right before you go to sleep or right before you lay down, and you maybe just read a book or even just listening to music, that can help you get some rest too. Okay, so that might even bring your sleep down time from when you lay down, might bring it down to about 30 minutes. Yes, I totally agree with you. Yes. You can do that too. Sometimes I tell my patients when they take a bath or they take a hot shower right before they lay down that does help. I agree. Okay. So today, what the doctor wants to do is he wants to discuss with you other methods to help you get some sleep, okay? He wants to see if he can take you off of the Ambien and get you onto something else. Yes. Well, the reason being is we've been having reports of, like you did, the hallucination, and that's not good. We're trying to prevent our patients from having to rely on the Ambien one to get some sleep, but we also want to make sure that we can help them sleep effectively without the horrible side effects of hallucinating. That's not really a good thing. I completely agree with you. Okay. All right. So I just want to make sure I have my information correct. Okay. You are 35. Okay. You are 5'6". That's right. Okay. Are you still at 1-1 Crescent Place? Okay. Yes, ma'am. We're just going to be updating our records. Once the doctor comes in, I'll be updating your records. So, can I have an email for you as well? Okay, at Gmail. Okay, so I'm just going to give you a few techniques to help you relax yourself before you go to bed. Okay, so what I usually try to remind patients, what I usually try to do is help remind patients that in order to have a more relaxed, restful sleep at night, it's best if you try to clear your mind first. So what you want to try to do is when you lay down and you dim the lights and or even turn off the lights and you close your eyes, try just to completely clear your mind. You want to try to relax every muscle in your body. You want to try to just try to relax from head to toe. Usually you'll start to feel your body just really, really heavy. And you want to just really try to loosen all the muscles in your body. And that usually helps a lot because you'll be so busy concentrating on relaxing that you won't even realize you fell asleep. Yes, I do that a lot. And it definitely helps to try to take a bath or a hot shower before you lay down. Usually if you have too much activity, it makes it harder because you're too busy trying to, do a few things at one time. Okay, so is there anything you want me to update the doctor on for you? Okay. Right. So we can help you with that as well, okay? Yes, ma'am. Okay, so I have all your information here, and I'm going to remind Mr. Webster that this is not your first time here. And I do sure hope that things get better for you, and they will. Like I said, sometimes relaxation is the best for everything. Yes, ma'am. And I hope that you have a nice evening, okay? If I don't see you before you leave, remember, relaxation is the key.